ऐसा है ना? झाल स्टार्ट
That could help. Good morning, everybody. Today we are going to see the next topic, that is radiation biology. Okay. In last class we have started radiation biology. Now we will see the remaining topic. So radiation biology means study of the effect of the radiations on the living system. And chemistry we have seen direct effect and indirect effect. Direct means radiation will directly hit to the DNA and causes damage to the tissue. And in the indirect effect, we have seen that the radiation don't directly hit to the tissues. First, it come in contact with the water, and it breaks the water molecule into the two, and it produces free radicals, and these free radicals are dangerous, which damage the living tissue. Then we have seen the changes in the DNA. This is fragment cause of radiation, which causes the death, cell death, and or the mutation in the cancer formation. Then we have seen the deterministic and stochastic effect. What is the most common question asked in the exam? Deterministic and stochastic effect. Difference between deterministic stochastic effect. Deterministic effect means it is a greater dose or the lethal damage to the tissue, and it is the dose independent. But the stochastic effect is the sublethal damage to the individual. It it causes a mutation in the cells and result in the cancer formation instead of killing the cells. Then we have seen the deterministic effect on the cells, that how it affect to the intracellular structures, then how it affect on the nucleus, chromosomal aberrations, how it affect and cell replication. Then we have seen bystander effect. This is the most common question asked in the Viva. Bystander effect: cell that damaged by the radiation releases a molecule into the intermediate environment, and that molecule which is released, which kills the cell, nearby cells. And this effect causes a chromosomal aberration, killing, cell mutation, and the carcinogenesis. Then we have seen apoptosis. Everybody knows apoptosis means programmed cell death, occurs during normal embryogenesis. Then we have seen radiosensitivity, high, intermediate, low. Then modifying factors, reversing dose rate, and oxygen, linear energy transfer. Linear energy transfer (LET) is the dose required to produce a certain biological effect. It produces as the LET of the dose is increased. Means LET is inversely proportional to the biological damage, and thus the higher LET radiations are more effective in damaging the biological system because of their high ionization density is more likely than the X-rays induced double stranded breakage of the DNA. Lower the LET, linear energy transfer radiation, such as X-rays, deposit their energy in the absorber, and thus more likely to cause a single strand damage and less biological effect. Radiation therapy on the oral mucus. oral mucous membrane or the oral cavity that we will see now. How the radiation will affect in the oral cavity. Whenever the patient is going for radiation therapy, everybody knows radiation therapy is given for the cancer patient. What are the side effects while taking radiation therapy? So, every organ of the oral cavity will be affected due to radiations. How it will be affected? First, we will see rationally is the fractionation of the X-ray dose, total dose. Fractionation of the total dose into multiple small doses. It reduces the destruction of the cell and increases the repair or the healing of the cells. So fractionation allows for increased cell repair in the normal tissue and also allows for increasing the means of oxygen tension in irradiated tumors, rendering the tumors as radiosensitive. So the fractionation of the total dose is important. It reduces the cell destruction and result in the improvement of healing. So effect on the oral mucous membrane. Everybody knows mucous membrane is covered with the epithelial lining. It contains a basal layer of rapidly dividing cells, which is radiosensitive stem cells. And near the end of second week of radiotherapy, as the cell dies, the area will become more sensitive, reddish, and due to inflammation. When the radiation therapy will go on the second week, due to the radiations, these cells will freeze in the basal layers and which gives the appearance of redness due to the inflammation. Okay, as the therapy continues, the mucous membrane it becomes more sensitive and it separates dead layer of the dead upper layer of the skin. So the upper layer will be whitish due to avascular surface and yellowish, that is yellowish pseudomembranous slough, white slough will be separated from the underlying connective tissue. And the after the second week of therapy, and at the end of the therapy we will see the severe mucositis. Mucositis means the inflammation of the mucosa. There will be more discomfort and patient will be having more difficulty in food intake and having the food. Therefore you should ask the proper history whether the patient is having undergone radiation therapy and all. Okay, and see the oral mucosa, how it is, whether there is traumatic and mucosa is, have you seen any slough, mucosa slough and all. Then what treatment you will give? Topical anesthetics to reduce the inflammation. Topical anesthetics will be given after the each meal. There will be secondary infection like Candida, chances of secondary infection like yeast infection, Candida albicans. This question also they can ask what radiation effect will be seen on the oral cavity. So that each organ you should mention like oral mucous membrane, teeth, salivary gland. And so after radiation therapy is complete, the mucosa begins to heal rapidly. Healing is usually completes by the second month. So you should follow the patient who are undergoing radiation therapy to see the changes. Later, the mucous membrane tends to become atrophic, thin, and relatively avascular, and this long-term atrophy results from progressive obliteration of the fine vasculature and fibrosis of the underlying tissue. So these changes, the complication of denture wearing because of oral ulceration of the compromised tissue. Understood? Next, how the test bud will be affected. So everybody knows the taste buds, which is present on the tongue, and anterior two-third, anterior one-third will give the salty and sweet taste, and posterior two-third bitter and acidic taste. So the taste buds are more sensitive to the radiations, and therapeutic doses causes the extensive degeneration of the histological architecture of the taste bud, and patient often notice the loss of taste acuity during the second and third week of radiation therapy. So during the radiation therapy, the patient may have loss of taste sensation. Like bitter and acidic flavor are severely affected when the posterior two-third is irradiated, and sweet and salty taste is lost when the anterior one-third is irradiated to the radiations, and taste acuity decreased by factor of 100 to 10,000 during the radiation therapy. So taste loss is reversible, and recovery takes place 60 to 120 days. It, it is reversible. It can be reversible. It can be recovered up to 60 to 120 days, means 2 to 3 months. Then next, how the salivary glands will be affected. Everybody knows there are three salivary glands: parotid, submandibular, sublingual, and it secretes the saliva. So when radiations, the salivary gland will be irradiated. Radiation falls on the salivary gland. What will happen? There will be less secretion of the saliva, or the salivary cells will be obliterated. So we will see the parenchymal component of salivary gland is radiosensitive, and a marked progressive loss of salivary secretion is usually seen in first few weeks after the initiation of therapy. So in the starting of radiation therapy only, you will see the loss of salivary secretion, and extent of reduced flow is depend on is the dose dependent. So what symptoms patient will be having? In the initial radiation therapy, the patient will be having dryness, tenderness, and there will be the difficulty in solving and pain while eating. The patient will be having. Patient with the irradiation of both the glands are more likely to complaints of dry mouth, difficulty in chewing and swallowing due to the less secretion, and there are also more chances of caries formation. Serous cells are more radiosensitive than the mucous cells, and residual saliva is more viscous. The saliva has reduced pH. You will see radiation, the patient who are undergoing radiation therapy, there will be reduced pH, 1 unit less. This pH is sufficient to causes the decalcification. Buffering capacity of saliva falls down below the 44%, and if some portion of the salivary gland are spared, dryness is usually subsides in say 6 to 12 months because of compensatory hypertrophy. So this is also reversible process. After the radiation therapy stop, dryness and all will be subside after in the 6 to 12 months. In month later, the inflammation response becomes a chronic, and the gland demonstrate a progressive fibrosis, adiposis, loss of fine vasculature, and concomitant parenchymal degeneration. So there are more chances of fibrosis Stiffness bands will form in the gland, fibrosis formation, parenchymal regeneration. Then next, we'll see the how the teeth will be affected due to radiation. So here we'll see after calcification, before calcification. So children subjected to the radiation therapy may show defect in permanent dentition such as retarded tooth development or dot tooth or the failure in the form of one or more. This before the calcification. If exposure precedes calcification, radiation may destroy the tooth bud. Before the calcification, if tooth buds are get exposed, then there will be destruction of the tooth buds. There might be loss of tooth or abnormal tooth formation. Irradiation after the calcification has begins mainly with cellular differentiation causing the malformation, arresting general growth. Eruption mechanism is totally resistant. So, if the radiation happens in the small cancerous patient or the pseudo patients before the calcification, eruption will be affected. After the calcification, you will notice the dark tooth development, retarded tooth development, failure in the tooth formation, and there will be the radiation caries. So, radiation caries is 2 mark question, or they can be asked as a short note or 4 mark question. Radiation caries. Caries which is formed due to radiation. This is the radiation caries, and it is same appears as the rampant caries. So how it involves and how it is classified. You see, it is a rampant form of dental decay. Receiving the radiation therapy shows the acidogenic saliva and the plaque, and shows the increase in Streptococcus mutans, Lactobacilli, and Hendricus. So this radiation caries is also associated with the uh, bacteria. Usually the caries is especially due to Lactobacillus streptococcus mutans. Radiation caries may also involve Candida albicans. The caries is due to reduced salivary flow and decreases the pH. As I told, the salivary gland is affected due to radiations. There will be less flow of saliva, and there will be more chances of dryness and decreases the pH, reduces the buffering capacity and viscosity. There will be altered flora so that there is more chances of formation of dental caries. The reduced saliva has the low concentration of calcium, resulting in the greater solubility of tooth structure and reduces remineralization. So how it is classified? You should write whenever you are writing a short answer for the correlation of radiation caries. You should write the 3 types of radiation caries. They may ask in the bypass what are the classification of radiation caries. So it is divided into 3 types. First, the caries involves the buccal, occlusal, incisal surface of the tooth. You can imagine there is the bacteria and Streptococcus mutant attached to the first buccal, occlusal, incisal surface. Because of the dryness of the mouth, they uh, tends to develop further, produces a more acid and causes a damage to the buccal, occlusal, incisor palatal surface. Another type involves primarily the cementum and dentin in the cervical region. It damage to the cementum and dentinal cervical region, that is the CEJ junction, where the tooth and gingiva attach. First, it attack in the first step, it will affect only occlusal incisor palatal surface. In the second step, it will affect cementum and cemento-enamel junction. Lesion it progress circumferentially and result in the loss of crown. In the last stage, you will see complete dark pigmentation and entire crown has gone. Incisal edge has badly worn out. So, what treatment you will give? So, before going to the treatment, you should diagnose it by asking the history, proper history, whether the patient has undergone radiation therapy. It patient may have undergone radiation therapy before 6 months or 1 year. Then also you can see the radiation caries that you have to ask, and whether the all teeth are involved with the random caries that you have to see. Proper history asking and a clinical examination. This will give the proper diagnosis of radiation caries. Then you will go for treatment. So what treatment will you give? First, daily application of for application of the sodium chloride gel for the 5 minute, which is uh, in the custom made applicator or the trays during radiation therapy. Use of the fluoride causes 6 month delay in radiation induced elevation of Streptococcus pneumonitis. So fluoride application will delays the radiation therapy. Then restoration, excellent oral hygiene, carcinogenic food restrictions, and sodium fluoride application, which reduces chances of caries. Grossly caries and periodontal involved tooth are extracted before irradiations. Next is bone. How the bone will be affected due to the radiation. As everybody knows, bone is formed with osteoblast. Osteoblast will help in the formation of bone cells and osteoclast destruction. Primarily, the damage to the mature bone results from the radiation-induced damage to the vasculature of periosteum and cortical bone. Radiation also acts by destroying the osteoclast and less resistant of the osteoclast and the osteoblast. Normal marrow is replaced with the fatty marrow and fibrous tissue, so the bone will be lost their density after undergoing the radiation therapy. Then the marrow becomes a hypovascular, hypoxic, hypoxemia. There will be the less blood supply, less oxygen supply, and less cells. So that it is going to more necrosis. The endosteum becomes atrophic, shows a lack of osteoclastic activity. They reduce the degree of mineralization, leading to the brittleness of the bone. And when these changes are more severe, the bone death results into the osteoradionecrosis. This wolf bone, these changes will be more severe. There will be the more hypoxia, more hypocellularity, more hypovascularity, and this progressed and it causes a uh, cell death and bone death. Bone death results into the osteoradionecrosis. Osteoradionecrosis means osteo means bone, radiation, necrosis, death. Necrosis, death occurs due to radiation. Bone death occurs due to radiation. Decreases the vascularity of the bone, renders it easily infected by the microorganisms from the oral cavity. This bone infection results from radiation-induced breakdown of the oral mucous membrane by the mechanical damage to the weakened mucous membrane, such as when denture sores or due to extraction through the periodontal lesions or the radiation caries. More commonly affected region is mandible than the maxilla. So osteoradionecrosis is seen more commonly in the mandible than in the maxilla due to less blood supply, less vascularity. Then how the musculature is affected. Radiation causes the inflammation and fibrosis resulting in the contraction and stress in the muscles of mastication. Fibrosis which leads to contraction and trismus, and usually the masseter and pterygoid mucous membrane are involved. Everybody might know the masseter origin and insertion of masseter and pterygoid plates, and restriction in the mouth opening usually start about second month after the radiation therapy is complete. Restriction is due to fibrosis, which causes constriction and trismus. And you will see after the second month there will be the fibrosis, more fibrosis and restriction of mouth opening. And it can be progress after the radiation therapy. Exercise program is helpful in increasing the large mouth opening. So the tell the patient mouth exercise or the use of Ferguson mouth opener. Then we see the deterministic effect of the whole body radiations. That is acute radiation syndrome. What is acute radiation syndrome? It is the collection of the signs and symptoms experienced by the person from acute whole body radiations. See, if one or two gyrates is radiated, or the person has taken the whole body, there will be prodromal symptoms you will see. This stat is very important, and if the dose is 2 to 4 gyrates, you will see the mild hematopoietic symptoms, and if the dose is from 7 to 4 to 7, then you will see the severe hematopoietic symptoms, and if the dose is from 7 to 15, you will see the gastrointestinal symptoms, and more than 50 gyres, you will see the CNS and CVS damage. So dose in 1 to 2 gyres, you will see the prodromal symptoms. What is prodromal symptoms? What it means? Like few of you known prodromal symptoms means symptoms occurs after the exposure. Within the first few minutes to hours after the exposure of whole body irradiation of about 1.5 gyres, the individual experiences anorexia, nausea, vomiting, diarrhea, weakness, fatigue, and the higher the dose, more rapid the onset and greater the severity of the symptom. Next is the latent period will be there. After the 1 to 2 gyres with radiation, we will see the latent resting period. The period of well-being during which there is no symptoms and signs of radiation sickness occurs. That is the latent. We will not see any signs and symptoms in this period. The period extends from hours or the days after the supralethal exposure to the few weeks after the exposure. Then hematopoietic syndrome that I told, when the body is exposed to 2 to 7 virus, it causes injury to hematopoietic stem cells of the bone marrow or the spleen. Hematopoietic cells, which is you will see in the bone marrow and the spleen, although you will find out there is formation of RBC in blood bone marrow. So the 2 to 7 gyres causes the injury to hematopoietic stem cells. Higher the mitotic activity of these cells makes bone marrow and highly radiosensitive tissues. The dose in this range causes a rapid fall in the number of circulating granulocytes, platelet, and finally erythrocytes. So it's directly processed as the radiation damages to the hematopoietic stem cells. Your Platelet, granulocyte, erythrocytes counts also decreases. Clinical signs, you will see that there will be the more chances of infection due to reduced number of platelets, which helps him healing, and there will be the more hemorrhage, more chances of anemia due to erythrocytic count has down. What will happen? The patient, if this will progress, then death from the hematopoietic syndrome occurs in 10 to 30 days after radiation. Next, we will see the GIT syndromes, gastrointestinal syndromes. In the range of 7 to 15 gyres, causing the extensive damage to the gastrointestinal symptoms, in addition to hematopoietic syndromes, and it causes the extensive injury to the rapidly proliferating epithelial cells and leading to the rapid loss of the epithelial layer of the GIT mucosa, and causes the denudation of the mucous surface. So there will be thickening, irritation, ulceration of the inner lining of mucous membrane, and there will be the more chances of hemorrhage, and there will be the loss of plasma electrolytic level, and these changes are responsible for diarrhea, dehydration, loss of weight, due to electrolytic imbalance. And endogenous intestinal bacteria rapidly invades the denuded surface and it causes the septicemia. When the damage to the GAT reaches the maximum, it affects the bone marrow and it causes the depression of the bone marrow and is beginning of the manifestation. It results is marked lower in the body defense mechanism, so there will be more chances of bacterial infection to grow and decrease the effectiveness of the clotting system, and the combination effect of both the systems causes the death within the 2 weeks from uh, disturbed electrolytic balance, fluid loss, infection, and possibly nutritional impairment. How the CNS and CVS syndromes, CNS CVS will be affected. The exposure, if exceed than 50 gallons, usually causes the death in 1 to 2 days. At this level, collapse of circulatory system with the precipitous fall in blood pressure in hours preceding the death. Victims also may show intermittent stupor, incoordination, disorientation, confusion, convulsion, suggestive of extensive damage to the nervous system. So what management you will do? Antibiotic are indicated when granulocytes count as fall. Fluid electrolytic replacement are necessary. Whole body transfusion to treat anemia, platelet, and to arrest thrombocytopenia. The rest all we will see in next class.